Next time, internal male genital organs. They are testes with epididymis, then deferent duct or vas deferens together with spermatic cord, then seminal vesicles and prostate gland. We start from testes. Greek name of testes, that is orchis, that is why inflammation of testes, that is architis. And another name is didymis, the same. That is why near of testes we have structure which has name epididymis. Testis has connective tissue coat, external connective tissue coat, which has name tunica albuginea, and from this coat start a lot of septular testis, which separates testis into the lobules, and inside of these lobules we have convoluted tubules, tubuli seminiferi contorti. They continues into tubuli seminiferi recti. Tubuli seminiferi contorti, that is place where spermatozoid produced. And tubuli seminiferi recti continues into mediastinum testis, that is place between testis and epididymis, and forms his network, rete testis. From network start ducts, ductuli efferentes, which goes to the head of epididymis and makes his ductus epididymidis. And this duct continues into ductus deferens or vas deferens. That is deferent duct, and this duct consists of 4 parts. Ductus deferens consists of pars testicularis, which is behind of testis, pars funicularis, inside of spermatic cord, pars inguinalis, in inguinal canal, and last part is pars pulvina. And the pelvic part at the end of deferent duct makes ampule, ampulla ductus deferentis, and this ampule joined together with excretory duct, ductus excretorius, that is duct of the seminal vesicle. And ductus excretorius together with ductus deferens joined and makes ductus ejaculatorius, and this duct opens into male urethra. One again. Number 1, that is a testis. Number 2, epididymis. Number 3, septular testis. And number 4, lobulus testis. Convoluted tubule, tubuli seminiferi contorti, number 5. Tubuli seminiferi recti, number 6. Network, rete testis, that is number 7. Ductuli efferentes, number 8. Ductus epididymidis, number 9, and number 10, that is ductus deferens. That is letter A, it is pars testicularis, letter B, pars funicularis, letter C, that is inguinal part, and letter D, pelvic part. And number 11, that is ampule, ampulla ductus deferentis. 12, that is seminal vesicle. 13, ductus excretorius, and 14, ejaculatory duct, ductus ejaculatorius, and number 15, that is urethra. 16, that is prostate gland, and 17, that is urinary bladder. This diagram you need to draw next time. That is internal structure of testis and pathway of seminal fluid. Some words about coats of the testis. I think you know that testis develops in abdominal cavity and descend into the scrotum. And scrotum consists of some layers which correspond to the layers on anterior abdominal wall. That is the scrotum. Here it is testis. That is the testis together with epididymis. And here it is anterior abdominal wall. And first layer on anterior abdominal wall, that is the skin of anterior abdominal wall. And the skin continues into the skin of scrotum. That is the same number one. That is first coat of the testis, skin of the scrotum. What is under the skin on anterior abdominal wall? What is this coat below of skin? Help me. What is it? Subcutaneous fat. Subcutaneous fat. But on the scrotum, fat tissue is reduced. Here it is a lot of connective tissue together with smooth muscles. And name of this coat is tunica dartas. Tunica dartas consists of subcutaneous connective tissue with smooth muscles. Number two, tunica dartas, it corresponds to subcutaneous fat tissue. Below of fat, subcutaneous fat, what is next coat on anterior abdominal wall? Next layer. What is under the fat? Please? Please?
Smooth connective tissue.
No. Peritoneum, that is most inner coat. And what is under the fat? If we cut skin, under the skin fat, what is below of fat? Please? On abdominal wall? Fascia, superficial abdominal fascia, fascia abdominalis superficialis. That is next coat of anterior abdominal wall, and this fascia continues into external seminal fascia, fascia spermatica externa, external fascia, fascia spermatica externa. That is third coat, number 3. Then, in the region of superficial inguinal ring, we have fascia intercruralis. It is in the region of annulus inguinalis superficialis, and this fascia continues into fascia cremasterica. That is fourth coat. Fascia cremasterica, number 4. Fascia cremasterica, and this fascia correspond to fascia intercruralis on anterior abdominal wall. Next coat, that is the muscles. Which muscles do you know on anterior abdominal wall? Musculus obliquus externus, internus, and transversus abdominis. And transverse muscle, together with musculus obliquus internus abdominis, continues into musculus cremaster, musculus cremaster, musculus cremaster. That is fifth layer, fifth coat. Musculus cremaster, it corresponds to musculus transversus abdominis and musculus obliquus internus. Next coat, what is behind of musculus transversus? What is it? Fascia transversalis. Very good. That is sixth layer on anterior abdominal wall, and here it is fascia spermatica interna, internal spermatic fascia. That is sixth coat. And last coat, you already said, that is peritoneum. In time of descendance of testis, peritoneum makes blind process, that is processus vaginalis testis. That is blind process of peritoneum. That is processus vaginalis. But after descendance of testis into the scrotum, peritoneum separates from this processus vaginalis, and here it is peritoneum reduced, and only we receive last coat, which is surround testis, that is number 7, tunica vaginalis testis. Tunica vaginalis testis. It is continuation of peritoneum, and tunica vaginalis consists of parietal layer, that is letter A, and visceral layer, that is letter B, and space between them, that is cavum vaginalis testis. Sometime after descendants of testes, communication between this cavum vaginalis and abdominal cavity is present. Sometimes heat is peritoneum not reduced, it present heat is like processus vaginalis, and in this case we will see opening on anterior abdominal wall in the region of deep inguinal ring. In this case we receive hernia, inguinal hernia, and intestine, for example, can descend into the scrotum. If heat is, we have communication between tunica vaginalis and abdominal cavity. But in normal, it should be closed, and tunica vaginalis, it's only surround testes and not continues into peritoneal cavity, into parietal peritoneal layer. That is why next time you should know names of these codes and which code correspond to which layer on anterior abdominal wall. Not necessary to draw this diagram, only you should answer, or maybe written test, you should know names all of these layers and names all of these codes. What else? We already discussed that heat is seminal vesicle, vesicula seminalis, and heat is deferent duct, ductus deferens, and we can see that heat is pars pelvina and terminal end of pars pelvina, that is ampule, ampulla ductus deferensis. At my diagram, that is number 11. And this ampule joined together with a duct of seminal vesicle, that is vesicula seminalis, and duct of seminal ductus excretorius, that is number 13, continues into ejaculatory duct, which opens into, it passes through prostate gland and opens into urethra. That is right ductus deferens, heat is left one, that is left seminal vesicle and right seminal vesicle. Clear it is? And that is prostate gland. Prostate gland. It consists of smooth muscles and make additional sphincter of male urethra, and consists of glands which secrete fluid which is in large volume of seminal fluid, the same like secret of seminal vesicles, the same, that is nutrition for spermatozoids and increased volume of seminal fluid. Some words about prostate gland. Prostate gland, the same, it is only for your understanding. That is horizontal section of prostate gland. Anterior surface is convex, and posteriorly it has place where ejaculatory duct insert. Heat is urethra, and that is right and left ejaculatory ducts. And these two ducts separate prostate gland into three lobes. Heat is lobus sinister, lobus dexter, and lobus medius. Middle lobe, right and left lobe. In urethra, posterior wall of urethra has it's look like tubercle colliculus. That is, look here, that is urethra. And posterior wall of urethra has eminence, that is colliculus seminalis. Laterally from the apex of this colliculus, we can see openings of ejaculatory duct here and here. Ejaculatory ducts opens into urethra near of colliculus seminalis. And laterally from this colliculus, we can see a lot of openings of prostatic glands. They opens into urethra, the same laterally from colliculus seminalis. And this colliculus on the apex has blind fossa, that is utriculus prostaticus, small uterus, utriculus prostaticus, in place where in time of development two paramesonephric ducts join together. That is all, I think. I think that is all, yes. On preparates, what else? That is a testis, and you can, heat is epididymis. Heat is head of epididymis, body and tail, and space between testis and epididymis on the lateral side look like sinus, sinus epididymidis. On medial side there is no sinus. Heat is, sinus is absent, but laterally we can see space between testis and epididymis, and this sinus help you to identify is it right or left testis, because sinus should be laterally and epididymis is behind, posteriorly from testis. Is it right or left? It is right, yes, that is right testis, and that is the same right testis, because heat is epididymis, that is head of epididymis, body and tail, and that is a space sinus epididymidis. Heat is, there is no space, there is no, that is only heat is tunica vaginalis testis, that is parietal layer, and heat is visceral layer, and there is no space medially, and laterally heat is sinus epididymidis. That is spermatic cord, funiculus spermaticus, and this spermatic cord consists, first of all, heat is deferent duct, ductus deferens, some codes of the testes, fourth, fifth, and sixth codes participate in spermatic cord, that is fascia cremasterica, musculus cremaster, and fascia spermatica interna. These three codes present in spermatic cord. And the same heat is vessels and nerves. For example, arteria testicularis, it supplies testes. Arteria deferentialis, it supplies deferent duct. Plexus pampiniformis, that is venous plexus from testis, it continues into vena testicularis. And nervus genitofemoralis, it has two branches, femoral and genital. That is why genital branch, ramus genitalis, from nervus genitofemoralis, the same, participate in spermatic cord. But main structure in spermatic cord, that is deferent duct, ductus deferens, heat is. That is all. Please.
Here.
Male urethra, we continues together with external male genital organs. When you will study penis and the same male urethra. That is why next time not necessary to read. Next time we will discuss external male together with male urethra. That is why only testes. Internal male genital organs. That is topic number 12. Testes. Heat is ductus deferens. That is descendants of testes. What else? Prostate gland. Bulbourethral gland. You read it, but I explain it together with external male genital.